For the past 10 years or so, I've been working with National Geographic to identify geographically defined, demographically confirmed parts of the area where people live measurably longer. These are populations, not just individual experience, tens of thousands of people in most examples. And then working with other experts to find their common denominators. I wrote this up in a book called Blue Zones. You don't have to buy the book because in the next 90 seconds I'm going to tell you all the essential secrets. No matter where you go in the world, whether it's Okinawa, Japan, Sardinia, Italy, the Highlands, the Nicoya Peninsula of Costa Rica, Ikaria, Greece, among the Seventh-day Adventists, you see the same 9 things happening over and over and over among the longest-lived people. A lot of these things are very intuitive. Eating a plant-based diet, low in simple carbohydrates, high in things like beans and nuts. The ever-popular prescriptive to have a couple glasses of wine a day. And no, you can't save up all week long and have 14 on the weekends. People actually ask me that. But the really cool findings come from the counterintuitive things. Do you know that people who have a strong sense of purpose and who can articulate it live about 7 years longer than people who don't? People who belong to a faith-based community and actually show up 4 times a month live 4 to 14 years longer than people who don't. And none of the longest-lived people in the world, and I interviewed 253 of them, ever exercised in the way we think of exercise. They did, however, live in environments that constantly nudge them into physical activity. They burnt about 5 times as many calories as we do in non-exercise physical activity. They lived anywhere from 7 to 11 years longer than we did, with a fraction of the rate of chronic disease. These are populations. One of them is even an American population that lives a decade longer than the rest of us. But as you know, you can tell people all day long the things they ought to do to live longer and to be healthier. But how do you actually get a population to do them? We spend almost $1 trillion a year on largely preventable diseases, cancer, diabetes, heart disease, largely preventable diseases. But I assert we not only are spending too much, but we're aiming at the wrong target. If you look at what really drives disease and cost in this country, about 80% of it is lifestyle and environment. Only about 10% is genes. This is on a population as a whole. And healthcare accounts for another 10% of it. But now look at the way we spend our money. This incidentally comes from the CDC. We spend only about 4% of all our healthcare dollars on prevention. And then we spend 88% of them on cleaning up the problem after the problem has happened. We're aiming at the wrong target. Instead of the downstream problems, we should be aiming at what to do before they happen. I think most of us know that. We do spend over $100 billion a year on prevention. So you may say, Dan, you know, we're an overweight population here in America. We don't move enough. We should be focusing on diets and exercise and supplements. The problem is, by and large, they don't work. When you think of things that are going to truly add to longevity, to truly lower your chances of getting a chronic disease, you cannot think in months or in years. You have to think in decades or a lifetime. So you say, well, diets, they're a pretty good idea. But no diet in the history of the world has ever worked for a significant proportion of people who started. We could come up right now, we could spend the next 3 days and come up with the TED Med diet. The best minds on the planet when it comes to medicine come up with a TED Med diet. We get Mark up here and Jay up here, and we do a man hug, and we get people all pumped up about it. But the reality of diets, if 100 people start a diet today, within 7 to 10 months, you'll lose 90 of them. And within the next 2 years, you'll lose all but about 5% of them. So when it comes to a long-term strategy, diets don't work. No diet in the history of the world. Exercise has a similar recidivism curve. We were able to find data on gym memberships. Out of 100 people who start a gym membership today, in 3 years, you'll lose about 90% of them. This is a bit of a heresy, I know, but when it comes to public health, exercise just isn't working. The average American only burns 100 calories per day engaged in willful physical activity. exercise. Supplements, whether they're medicinal or nutraceutical, about the same thing. We may say statins and aspirin are really good for people to take, but you don't get a critical mass, you don't get enough people taking them over time. So based on these findings, I went back to National Geographic and I proposed another blue zone type worldwide search. But this time I wanted to find communities that were unhealthy and got themselves healthier. And God bless that rectangular yellow heart of National Geographic, they funded me. Went all over the world and found out two remarkable things. Number one, of the tens of millions of dollars we spend on public health initiatives that aim at chronic disease, none of them have worked. There's one in Minnesota, Heart Healthy. There's the one in Stamford, Connecticut, another one in California. What happens is more or less the health care equivalent of the Hawthorne effect. As long as the experts are there paying attention and the TV cameras are rolling, people will do what they ought to do, but as soon as they leave, people revert back to their baseline. So as a long-term strategy, it simply hasn't worked here in America. There are two places in the world where projects have started out with unhealthy people and made their populations healthier. One in France, northern France, the EPOL project, brought down the rates of childhood obesity and maintained them for 8 years. And the second place was in Scandinavia. They brought down the rate of cardiovascular disease by 90% and have maintained it for decades. And I was able to spend several months with these projects and really take a look at how they executed them, how they made them work. And I realized that the essence of their success hinged on a tenet that's very different than a tenet many of us subscribe to. These projects did not rely on individual responsibility to be successful. They didn't look at you and say, it is up to you to get yourself healthier. They realized that we're all part of a system, and you need to address the system. So based on that, I used some of the money of that grant to hire who I think are the greatest experts in America when it comes to optimizing an American system. This, by the way, is not a program. It's not a template. It's an operating system. It's a way of thinking. And I pulled together 6 people from various different disciplines to help me think about how do you optimize an American community for health. And our first finding was that we all live in a life radius. Most of us spend about 80% of our lives within about 20 miles of our homes and works. So that's the area that we're trying to make better. Now, what sorts of things influence a life radius? Well, number one, you have policy. Is it easy to smoke in this community? Can I smoke indoors and out? Is soda pop and salty snacks, are they cheap? Do daycare centers allow, the licensed daycare centers allow little kids to watch TV before age 2? Is there an opt-in or opt-out policy when it comes to organ donation in states? These things make a huge difference on a statewide level. The built environment. Is it easy to walk downtown? Are parks neat and alluring? Is it safe? You know the number one inhibitor to old people going out and getting exercise? The perception of safety. It doesn't even have to be safe. Just cleaning up graffiti will get more older people out. Robert Wood Johnson Foundation found that if you can just make the active option the easy option in communities, you raise the physical activity level of that community by 30 to 40%. No gym memberships, no yoga classes, no ab master. Just make the active option the easy option. Social networks, another thing that you can modify in an environment. If your 3 best friends are obese, there's a 150% better chance that you'll be overweight. How do you help people optimize their social networks or expand it if necessary? Then there's structures we spend our daily lives in, schools, restaurants. You know, we eat out 110 times a year. You could have a perfect kitchen, but if you're eating out a third of the time in places where they're over-serving you for every meal, there's a problem there. Schools, workplaces. And then sense of purpose. How do you imbue people with a clear idea of what their values are and what they're good at and give them an outlet? So this was a nice theoretical construct. This is where we got the name silver buckshot, evidence-based ways to unleash them on an environment. Well, thanks to AARP and the University of Minnesota School of Public Health, we got another big grant to actually audition 5 cities and come into the city most ready to adopt this blueprint. Albert Lea, Minnesota won, and they mainly won because the mayor, the city manager, the head of public health, the superintendent of schools, the head of Chamber of Commerce signed a pledge saying we're on board for changing the environment. Our experts came in and we just listened. We found out, for example, that they wanted to widen Main Street and raise the speed limit, something that we believe would tear the social fabric in half. Instead, we convinced them to use some of that money to create one walking vector from every neighborhood downtown. There was a beautiful place to recreate right next to downtown, this beautiful lake, but you couldn't get around it. So we took some of the street widening money and we created a path, which is now full all the time, optimizing the built environment. We built 4 community gardens. This is a city of only 19,000 people. Dr. Brian Watson came in and helped us optimize food environments. Do you know the one adjective that most assures that you will not order an entree on a menu? The healthy choice. Nobody wants the damn healthy choice. They want something good. Adjectives like crispy and fresh will get people eating the same food that was otherwise mislabeled. We have a dozen tweaks we can do to restaurants. Went in all the grocery stores, got them to flag healthy foods and even create checkout lanes where the impulse buys were all healthy. We went into all 7 schools and got them to adopt 9 policies, the most powerful one of which, a simple policy that prohibits kids from eating in classrooms and hallways. That one policy alone, much more impactful than whatever you put in the school lunch. That one policy alone will lower the BMI of that school by about 11%, and it's permanent. We went into about half the workplaces, appealed to individuals, and got them to sign a pledge to make permanent changes to their homes. Everybody took a risk assessment, longevity compass, we call the vitality compass, so we could get a baseline. We got them to do permanent things like grow gardens, let our experts come into their kitchens and trade out the 14-inch plates for 10-inch plates, and do things like put signs on the counter reminding people to pre-plate their food. Those 2 habits alone equate to about a 20 to 30% fewer calories in any given sitting. And then we went and helped people optimize their social environment. We took the people who were ready to change their behaviors and fostered long-term friendships with them. Over the course of 18 months, we got phenomenal media coverage. USA Today, Good Morning America, Nightline, Walter Willet, the dean of Harvard School of Public Health, came in and wrote a 2-page story on our little experiment and found the results stunning. U.S. News and World Reports came in a year and a half later and found out that everything we put in place was still working. And then our numbers, I think, mirrored the success of the idea. People's life expectancy went up, people's weight went down, and there was a 40% drop in city workers' health care cost. That, ladies and gentlemen, is where the rubber hits the road. I don't have to tell this audience that we have a health care problem in our country. 68% of us are obese or overweight, and that number's going up, along with costs. Diabetes is on the way up. And for the first time in living history, life expectancy of our children is supposed to go down. Is that because we're stupid? Or have somehow undergone a degradation of our moral character, or we have less discipline or love our children less than our grandparents or kids did? No. We live in an environment of ease and abundance. We are evolutionarily hardwired to crave fat and to crave sweetness and to crave rest when we can get it. But we cannot go to a pharmacy to fill up our car with gas, to rent a DVD without being routed through a gauntlet of salty snacks or sugar-sweetened beverages.